Persons not be avoided, follow standard infection prevention practices as recommended by your employer. So that information is in our infection control policy. Assist clients to gather resources that they would need to stay at home for up to 2 weeks if they become sick or need to minimize contact with others, such as medication refills. So could you please, when you're working with your clients, talk to them about this, talk to them about making sure you get enough of your medication over the next, however period of time, so that they don't run out. Make sure they've got enough potatoes and things in the freezer and anything else that they'd like to eat. Make sure, and toilet paper.
That's kind of impossible.
Yeah.
Oh, you know what? By the way, when I was in Walmart this morning, I overheard one of the checkers saying that they were supposed to get freight at noon and maybe have toilet paper.
There's a bunch of toilet paper I just came from Walmart.
So I was listening to NPR, and they had an interview yesterday or the day before with the National Grocers Association president, or anyway, some big hotshot. And he's saying, the supplies are there, and trucks are going out, and they are refilling the shelves. So if you go into Walmart, you may not see anything, but it'll come.
Yeah.
You just need to, you can ask, and it's good to ask, when do you expect another shipment to come in, so then you can time your visit to make sure that you can get the 20 rolls.
No,
And you know
one,
what?
they're letting you get one.
They're not overstocking because people are hoarding.
Yeah.
So
So
they're
they're
letting
letting
it run out.
because like Safeway, they're limiting it to 1 package per person.
Yeah. Walmart too.
I've heard that too.
The same with Lysol. I went and bought Lysol for my client's house, and they only let you get 2 cans at a time.
Perfect.
So.
Yeah, I think that's reasonable. During these times, it's reasonable.
Sure.
All right. So help your clients with the 2-week stockpile. All right. If your client is ill, in-home personal care workers in the DHS system should call the client's case manager to find alternative ways to support them. And we have a number of clients who are getting their supports paid for by Medicaid. So we would be doing that. Other in-home personal care workers should postpone non-essential in-home visits with any person that has a cough or fever until symptoms resolve. If possible, increase services provided by phone or online instead of in person. Phone services will not be possible for those providing assistance in the activities of daily living. So, like I was mentioning earlier, our prioritization with the red, amber, and green. So those people who are red must have our services there ready for them. So we're kind of ready to go with making sure that we have those particular clients cared for. Next bullet. CDC recommendations for people who have close contact in a home setting with a person who has COVID-19 are available here. And then you've got a website there for you to click on. If you're looking at this online, the link is there. And there's other contact information for local public health authorities in Oregon. And there's some frequently asked questions that you can go to. There's the link for that.
And you can call 211 and they'll tell you anything you want to know.
Is that for recording, or is it actually?
No, I called them this morning
Oh, is that
myself,
right?
and they called me back within 11 minutes.
Wow, that's impressive.
Yeah, so 211, any questions you have about it, you can call them.
Where do I find toilet paper? Sure. Yeah, some people are calling 911 because they don't have any toilet paper. Goofy. Anyway,
Like
so,
somebody who has toilet paper.
communications with caregivers, it's just a comment here, and I've already discussed with you the way we are maintaining contact with caregivers through the ERSP email and caregivers and so forth. Communicating with clients. This week I sent out this letter on orange paper, so if you see this orange piece of paper, it's because I sent it out to the clients. It's kind of what we're doing here now. I'm mentioning to the clients what we're doing as an agency to address the COVID-19, how we're staying on top of the information coming out of the Oregon Health Authority, how we're communicating with our caregivers and with our clients and so on, to hopefully put their minds at rest so that they can realize that we're doing something, not just sitting around and scratching ourselves. I've also added everything that we've just covered in this as a directive from the Oregon Health Authority. I've taken some of the things that are inappropriate out, but mostly it's all there. In addition to that, I have also added in here on this letter to the clients a bit that I've taken from the directives for assisted living. Assisted livings need to have a screening process in place. Like when somebody comes into the assisted living, they have to ask, now, have you had any signs or symptoms of respiratory infection, such as fever, cough, soreness, shortness of breath, and sore throat? Have you been in contact in the last 14 days with somebody with a confirmed diagnosis of COVID-19, blah, 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 it goes on and on. But I think it's important for our clients to be screening any visitors that they might have as well. And so I'm giving them some instructions on the kinds of things that they should be asking anybody who comes into their home. So I want you to know that I have sent that out to the clients. And the last bit here has to do with communications with other agencies, and I've already talked about that a bit. Any questions on our addendum to the infection control policy? No. Okay. So going back to the agenda, the last section here, the additional information. So by now, maybe you've heard some stories of how people are reacting to what's going on with COVID-19, and they're going into the stores and they're fighting over bags of dog food, for crying out loud. You know, it's going a little bit crazy.
Or yelling at checkers.
Yeah.
We should say thank you for coming to work. We need to remember to be kind.
Yeah. So we decided it's really, that's why it's on the top of the list here. Be calm. You know, don't lose your cool about this. It's going to be okay. And if you start to get all panicky, you're not going to be thinking clearly. So let's keep our heads about ourselves. Let's make sure that we are using common sense when we are handling these situations. If you've got any questions, you're feeling like, oh my God, this is getting overwhelming, you know, call the office. You can talk to Cindy as a nurse. You know, she's got loads of medical information stored in her brain.
Falling out the other end.
All right. Something I want everybody to do when they go into the client's home, and it's funny that they don't include this sort of thing on here from the directive. First thing you do when you go into your client's home, you say hello to your client at a distance, and you go to wash your hands. Wash your hands. Wash your hands. First thing when you get to the client's home, you wash your hands. All right, and when you wash your hands, and that's the next bullet point here, you use a paper towel to dry your hands. Because if you're in the bathroom or in the kitchen and you use a hand towel that's been used over and over and over again by the client, by their family members, and they wipe their mouth, you know, after they brush their teeth, you don't want to wipe your hands on that, man. Use a paper towel. Some of our clients are going to freak out about that. Oh, that costs money. I can't afford to be paying a bunch of money and then there's a shortage of paper towels. Don't use my paper towels. All right, so the next best thing would be to go to their linen closet. And you probably all know where the linens are kept, for the most part. And you open up the cupboard and you take a new clean hand towel that's in there, that's been washed and dried, and it's not going to have any germs on it. So you use that for the rest of your shift. So you go into there, you take a towel, you go to the bathroom, and you wash your hands properly, and then you dry your hands off, and you use that until the end of the shift. And then at the end of your shift, you put that in the hamper. Okay? I think this is a reasonable solution, because otherwise you're going to be like, drying off your hands. You want to do that? Don't use my paper towels. All right. 6 foot social distance for infection control. All right, everybody knows what 6 feet is now. You got a visual on that, and I think it's important for us to keep that in mind. That's hard to do. That's why you're all spaced out here. Some of you are actually closer than 6 feet, so, you know. So I mentioned this already. If your client is showing any signs of being ill, you have a right to ask them to cough in their elbow. You have a right to ask them to wear a mask as well. Because if you're working with them up close and personal, you don't want them coughing, sneezing, and possibly infecting you. So they're not going to. It's likely that they're not going to have a mask. So offer them one of yours. Have them put that on so that you can protect yourself. Or up close and personal. I learned on listening to NPR the other day that this virus can last for up to 3 days. If I sneeze and a droplet hits right here, it could be still viable for up to 3 days. So somebody else comes along and puts their hand on there, and then they could become ill. So, and it can last for up to 24 hours on a piece of paper or a piece of cardboard. So I want you to be aware of this little germ and what it's capable of doing. I saw a graphic on an email or a website the other day that shows the size of a virus compared to a red blood cell. We all know red blood cells are really, really small, but the size of a virus is minute compared to the size of a red blood cell. These things, thousands of them can exist in a tiny little droplet. If you're in a grocery store and you're in the bread aisle and I sneeze and you're walking, 20 seconds after I've been there, chances are those germs are still floating around and you could be breathing that in. So I want you to be aware of what you're doing in a crowded area and think about that. Any other comment on that?
Yeah, I'm gonna have a few comments when
After I've done my spiel. Okay, next bullet on the backside of this, wear gloves whenever it's possible if exposure exists when handling clothing, linens, blankets, and so on. So a client could be ill and they're breathing all night long and those droplets in their breath are resting on the blankets and the sheets and so on. So you need to be careful when you're handling bedding and putting together their laundry and so on. If they're ill, you should be using a mask, you should be using gloves in any case, and you're wrapping it up carefully and not flopping things around and possibly getting that stuff up in the air. Hold the laundry away from you as much as possible. And take it into the laundry room and keep it away from your clothing because you don't want that stuff getting on your clothes, right? It might also be a good idea if you bring a change of clothes with you if you're going from one plant to the other because you don't want to spread the infection that way on your clothing. So it might be a difficult thing to do to change. It might be a bit awkward to change clothes in one client's room or home or another, but it's something that perhaps we have to do, or you pull the curtains on your car. I don't know, maybe we have to be the creative.
But we have the aprons and the shoe covering, so if you go to multiple clients' home and it's not practical to change your clothes, you can use the protective equipment.
Yeah. So we got quite a load of
We have a ton of aprons
and sleeves,
yes.
And so we got quite a lot of that. Okay.
Well, this is if we know they're sick or.
But they're showing respiratory symptoms.
But this isn't for somebody who we've been with several.
And they're not sick.
Right.
Yeah, if they're not sick, then you don't need to worry about it too much. You should always be handling
Well, yeah.
your laundry with gloves and that sort of thing. But if they're ill,
We don't have
good point.
to
If they're ill,
wear, but we want to check right at this point.
And remember, the people that are red, they're homebound. Those are the people we would be bringing stuff into, and that's why we have to be extra careful.
it's also a good idea when you get home. That first thing to do is you take your dirty clothes off, you take a shower, you put new clothes on, and then you slither out the rest of your day at home. It's a good idea to just take that extra precaution, change your clothes, and take a shower. That's all I've got.
Now, I have a couple of things before we answer up for questions and answers about things. So when we were talking about if you have a cough yourself, if it's a productive cough, you shouldn't be coming to work. If it's a dry cough and you're no longer running a fever, it's probably okay if you're not like hacking coughing, because you're going to stress our clients out, number one, and that's not a good idea. So if you're like hacking coughing and it's you still, even if it's not productive, I would say don't come in if it's a hacky cough. The other thing I would say is that I don't know if you guys have had doctor's appointments recently, but a lot of the doctors now, they're having you, if you're feeling ill, they don't want you to come in. They want you to call them on the phone, and if it's something that they can manage with, talk to you about on the phone, that's how they're wanting to handle it. The hospitals don't want you showing up there. The thing of it is this, if you're running a fever and you're short of breath, that is time to get a hold of your primary care physician and even go into the emergency room if you're actually having a fever and short of breath, because those are the two main signs. The other thing I would say is this is flu and cold season. So because somebody has a cough or a cold doesn't mean it's the virus. This is both cold and flu season. And in fact, with regular colds and flus, it can live on the surface 2 to 3 weeks. So it's just universal precautions, washing your hands, and that sort of thing. And something else I wanted to say was, I don't know if anybody else heard this, but my sister, who lives on the news, was saying that the government is going to send every household $1,000, and if you have a child, plus 500 to kind of help through this. I don't know if you guys had heard that, but I'm hearing that that's the case.
Yeah, that's the case, and there's some
It's not-
discussion about whether or not it should be a one-off thing or should be an ongoing thing, depending upon how long this whole pandemic is going to last.
But I anticipate everybody will at least get one, because
Yeah,
they're talking about mailing them out next week.
yeah.
Well, I heard that it was for working people only,
Oh,
so,
I didn't hear that.
There are several different versions of it.
Yeah.
We'll just keep it in your mind, you know, it's possible that it can help. Okay, now we're open for questions.
okay. So when we first got in here, you were saying to have the masks. We don't need to be wearing them with our client unless one of us is feeling ill.
Yes.
So I
Yes.
don't need to just go over there and start wearing a mask
No.
and freak her out, okay?
No, correct.
Okay.
That's right. It's if you're feeling, well, if you're feeling unwell, you shouldn't be there. Unless it's, you're coming off the illness, like I said, if you've got a dry cough, that would be a time for you to wear a mask. If your client is ill, and your client is a red, so she needs to have the care. So if
Well,
she's,
she has a cough, but she's had it forever. She coughs at night, that's just her.
that's just her,
That's,
yeah.
that's,
So
yeah,
that's,
so you
not-
know the client.
Yeah,
right. You know the client, so you know, but if it starts, if she's unwell, she's got a fever, if she starts to have a lot more of a productive cough, because I think it's a dry cough. If it's more productive, meaning there's a lot more phlegm there, that's maybe time to, mask up and maybe have her mask up as well.
Also to remember about people that are coughing and sneezing, and it's an unbelievable amount of people that don't wash their hands, don't cough correctly, into the crook of the arm. That virus can stand in the air for a couple of minutes. So somebody could have sneezed and you didn't hear them, see them, and then walk through it. This is another good reason to avoid crowds. The grocery store until you have to go. Nobody needs to panic about getting stuff because they're all saying everything's there. We'll be restocking the shelves. They're just trying to not let people hoard. But just remember that stuff can hang in the air. And if everybody's using universal precautions, you really, really lower your risk. And I think the fact that restaurants have closed and a lot of these places where there's a lot of people, I'm feeling confident they're going to be able to stop this. It's going to be okay.
So, how about, you have a client that does not use any kind of chemical, which I do, any kind of chemical cleaning products or that?
yeah, what about her? Isn't that helpful?
Well, they're saying hot soapy water.
Okay.
If you could do that in that instance.
Okay.
Hot soapy water is a big help.
Okay.
Also, the essential oils kill viruses.
Okay.
And you can buy cleaning products made out of thyme oil and essential oils, and they do a great job. And they're healthy to breathe, unlike Lysol.
Yeah.
Okay. Anyone else, questions, comments, or input?
I have one other comment. If I haven't said it already, please be kind. Help people that need help. Because people are going to remember how you were before this started and after, and it's the right thing to do. So I'm just encouraging people to be kind. If you have an elderly neighbor that's shut in, see what you can do to help.
Also, if I can just add on to that, is also be understanding for people who aren't being kind, because it's all out of fear.
Yes.
And, you know, like, they changed Safeway hours, I don't know if you know this, but for people, who are high risk, people over 60, people who have asthma like myself, people who are pregnant, people who are high risk to this, they can go in Tuesday and Thursday mornings from 7 to 9, and they ask that anyone else does not go during that time. So I
Rosars
went
as
this
well,
morning.
and Walmart.
Yeah.
Rosars and Walmart did
Most
that
of the stores
too.
are doing it, but I just know Safeway. And I went this morning, and people are judging books by covers. I look like a regular healthy person, and they were being very, very unkind to me. I almost cried in the middle of the store. But you just have to kind of remember that they're just scared. That's the only reason why they were acting that way. So it is hard sometimes to be kind when people are attacking you, but I just have to remember they were elderly people who were afraid that I was going to give them some kind of virus. So I was just, I'm also high risk. I'm so sorry if I made you uncomfortable, and I walked away.
And that was a very good answer. I'm
Yeah.
also high risk.
Yeah.
You know, it'll make you, and I would say that if somebody was being rude to you, because maybe it'll make them stop and think about how they're behaving.
Yeah.
But I was in Fred Meyer yesterday, and there was a checker that was crying because people were screaming at her. I mean, this is just, that's not nice. So when it was my turn, I said, thank you for coming to work. Why were they yelling at her? Probably because they couldn't get something they wanted, or
There was
whatever.
an instance at Fred Meyer's where one of my friends who's a checker, all of her family's high risk, and she's wearing a mask. So somebody actually got the grocery side manager who made her take her mask off because it wasn't dress code.
That's terrible.
Yes. And let's just say I wrote her the perfect letter to give to that manager and to the union rep and to the store director.
Exactly, because that was totally inappropriate.
Honestly, it's amazing to me because when you're at the checkout stand, you're about 2 feet, 3 feet
Oh, yeah.
at maximum from these people, you know, and it could be anybody spreading germs. Honestly, if I was the owner of the Rose Hours or Safeway, I would have everybody wearing those masks. And it's just, it is what it is. These are the times that we are living in, and you need to protect yourself. But
Something I thought of yesterday, just be kind also, recognizing that we're all being good and environmentally sound and taking our bags back that are full of germs. Put your bags down before you take them.
That's a very valid point.
okay.
Some stores are giving free bags now, at least in Washington.
Oh.
I got thanked this morning for buying a bag instead of using my own, so.
All right, are there any other comments or questions concerning our discussion today on what we're doing for dealing with the coronavirus? No? Thank you so very much for coming in today. Much appreciated as you're here to take the time to listen to me.
And I'm available for phone calls. Generally, it's not how they do things here, but while all this is going on, I am available. And I want you to feel free to call me if you are worried. If you're gonna call me in the middle of the night, just make sure it's really important. Unless I can wait until 8 in the morning, you know. I get up at 5, by the way.